Hi, this is for the week 10 discussion. Describe to a client the nature and cause of glaucoma for both modern and Ayurvedic perspectives. In the modern perspective, glaucoma can be either open angle or closed angle glaucoma, and it can be either primary or secondary. And primary means that the cause is unknown, so we don't know what's actually causing the glaucoma. Secondary, it can be traced to eye irritation, certain medications, eye injury, something that actually impacts the eye, inflammation, tumors, cataracts, and it can also be linked to other diseases such as diabetes. So in secondary glaucoma, the signs and the symptoms are going to include those that are also happening in the primary glaucoma. So the symptoms are going to be essentially the same thing. Modern causes of glaucoma can be increased eye pressure. It can be due to a blockage in the aqueous humor channels of the eye, and this can then lead to pressure building up in the eye and causing glaucoma itself. Also, in primary or open angle glaucoma, the drainage angle that is formed within the cornea and the iris, if that can remain open, but then the drainage channels are blocked for any other reason, that can cause the fluid to drain improperly, and then the eye pressure to slowly be building up. Glaucoma can also be caused by damage to the optic nerve, and it can happen slowly over time. So it's a slow build-up. Glaucoma really is, even primary or secondary, can be really slow coming on. So regularly getting your eyes checked can prevent glaucoma getting even worse or progressing to a space that it can need much more invasive treatments. So angle closure glaucoma occurs when the iris is actually bulging forward and there is a narrow blockage to the drainage angle that's formed in the eye itself, and fluid can't adequately flow through it and exit the eye, so the eye pressure again is building up. And angle closure glaucoma occurs with, it can be sudden and acute. It can also occur gradually over the course of time. So in Ayurveda, the difference in the actual glaucoma is that in Ayurveda, it's seen as a whole symptom that involves the eye as an entirety. And the main symptom is going to be acute pain and headache sensation. So this can occur with chronic conjunctivitis, and if it's not treated, it can lead to glaucoma and other severe eye issues as well. Okay, I think that was for discussion question number 1. Discussion number 2 is advise your client how to advise early stages of glaucoma from Maharishi Ayurveda. So for early stages of glaucoma, you definitely want to keep a relationship with your eye doctor and make sure that you're maintaining your tests and everything like that with modern medicine, and then Ayurveda is used in conjunction to that, especially with something that can eventually lead to blindness, such as glaucoma, if it's not managed properly. So with glaucoma, you might be experiencing acute pain that's growing, the feeling like your eyes are being cut. It's like a very painful thing. That you could feel like there's pressure or growth mass in your eye. You could be experiencing discharge, having different feelings that are going on in your eye. And it could also show up as the swelling of your eyes, heaviness in your eyes, and your eyes having a dusty appearance. The treatment really is that's linked to Vata conjunctivitis. It could be also linked to Kapha conjunctivitis and other different kinds of conjunctivitis. The treatments is going to be the same. So maintaining your eye health is what is the most important thing, and being able to work with modern science to relieve the pressure and do different things to maintain your eye health is going to be the most important. So for question number 4, which is how do we treat macular degeneration in Maharishi Ayurveda? So macular degeneration is mainly based in the third layer of the eye, and it makes day vision very difficult, but in night vision, it's not so bad. So this is really because it's pitta predominant, and so in the daytime, you have more difficulty seeing, but at nighttime, you can have an easier time actually seeing. So treatment for macular degeneration in Ayurveda is going to be the swaras, and also to take amla berry juice directly into the eye, and you can do it with soaking a cotton ball and placing it on the eye, on the open eye, for about 20 minutes, and that can actually help with macular degeneration. So I hope that my answers to these questions are helpful for you, and I really appreciate you taking the time to listen into it. Thank you.